It's one of the most common medical issues on the planet, affecting more than half of all people over the age of 50, yet it's one of the last things anyone wants to discuss. It's a source of pain, discomfort, and honestly, a lot of anxiety and embarrassment. We're talking about hemorrhoids. Hemorrhoids are incredibly common, but because of where they are, most of us are hesitant to even say the word. If you're here looking for clear answers about what causes them, what the symptoms really mean, and most importantly, how to get relief and keep them from coming back, you are in the right place. So, let's start at the very beginning. What are hemorrhoids? Simply put, hemorrhoids, sometimes called piles, are just swollen veins in the lower part of your anus and rectum. A good way to think of them is like varicose veins you might see on someone's legs, but they're located in a much more sensitive area. Now, it's helpful to know that we all have these vascular structures. They're normal cushions of tissue filled with blood vessels that help us control our bowel movements. They only become a problem when they get swollen, inflamed, and start causing symptoms. There are two main types, and they're classified based on their location. First, you have internal hemorrhoids. These form inside the lower rectum. You usually can't see or feel them, and since there are very few pain-sensing nerves in there, they rarely cause discomfort. Often, the first and only sign of an internal hemorrhoid is painless bleeding when you have a bowel movement. You might see some bright red blood on the toilet paper or in the toilet bowl. Sometimes, an internal hemorrhoid can stretch and drop down, bulging outside the anal opening. This is called a prolapsed hemorrhoid, and that's when it can become painful and irritating. Healthcare providers actually grade internal hemorrhoids on a scale from 1 to 4, depending on how much they prolapse. Grade 1 hemorrhoids stay inside, while grade 4 have prolapsed and can't be pushed back in. Second, you have external hemorrhoids. These form under the very sensitive skin around the anus. Because this area is full of pain-sensing nerves, external hemorrhoids are usually the ones that cause the most noticeable symptoms. These can include itching, pain, discomfort, and swelling around your anal region. If a blood clot forms inside one of these, it's called a thrombosed hemorrhoid. This can cause sudden, severe pain, a hard lump near the anus, and a lot of swelling. This is often the most painful type of hemorrhoid and the one that might make you see a doctor. Understanding which type you might have is the first step toward finding the right solution. But what makes them swell up in the first place? It almost always comes down to one thing: too much pressure. So what's actually causing all this trouble? Why do these veins get so swollen and irritated? A variety of factors can dramatically increase your risk by putting extra pressure on the veins in your pelvic and rectal area. One of the biggest culprits is straining during bowel movements. If you're often constipated and have to push hard, that effort puts immense pressure on these veins. This is often directly linked to a low-fiber diet. Fiber is crucial because it softens your stool and adds bulk, letting it pass more easily. Without enough, stool gets hard, leading to that dreaded straining. Another major factor is sitting for too long, especially on the toilet. Spending too much time sitting there, maybe scrolling on your phone, allows blood to pool in those rectal veins, increasing pressure and letting them swell. Chronic diarrhea or constipation are also major contributors. Frequent bowel movements from diarrhea can be irritating, while the straining from constipation is a primary cause. Life events and physical conditions also play a huge role. Pregnancy is a very common time for women to develop hemorrhoids. The weight of the baby increases pressure on pelvic veins, and hormonal changes can cause the veins to relax and swell. The good news is that for many women, they disappear after giving birth. Aging is another risk factor. As we get older, the connective tissues that support the veins in our rectum and anus can weaken, making hemorrhoids more likely. This is why they're most common in adults between 45 and 65. Your daily habits matter too. Obesity adds pressure in the abdomen, which can contribute to hemorrhoids. And repeatedly lifting heavy objects, whether at work or the gym, creates surges in abdominal pressure that can lead to swollen veins. Now, let's talk about the symptoms this pressure creates, the stuff that really impacts your quality of life. For many, the most alarming symptom is rectal bleeding. Seeing bright red blood on the toilet paper can be scary, but it's a very common sign of internal hemorrhoids. It is critical, however, not to just assume all rectal bleeding is from hemorrhoids. It can be a sign of other, more serious conditions, so it's always worth getting it checked out by a doctor. Then there's the itching and irritation. This maddening symptom can happen when internal hemorrhoids secrete mucus, which irritates the sensitive skin around the anus. And of course, there is pain and discomfort. This is the classic sign of external or thrombosed hemorrhoids. It can make sitting for a long time unbearable and turn a simple bowel movement into a painful event. You might also feel a swelling or a lump near your anus, which is a common sign of an external hemorrhoid and can be pretty tender. These symptoms can be disruptive and just plain miserable to deal with. This is the part you've been waiting for, the solutions. Let's break this down into 3 parts: immediate relief, long-term prevention, and when it's time to see a doctor. When you're in pain, you want relief now. Here are some of the most effective at-home treatments. 1. Sitz baths, a classic for a reason. Just sit in a tub of warm water for 10 to 15 minutes, a few times a day, especially after bowel movements. The warm water helps increase blood flow, which reduces swelling and soothes the area. 2. Over-the-counter OTC remedies. You have a lot of options here. Creams, ointments, or suppositories with ingredients like hydrocortisone can reduce inflammation and itching. Wipes containing witch hazel can also be very soothing. Pain relievers like acetaminophen or ibuprofen can help with the discomfort. 3. Cold compresses. Applying an ice pack or a cold compress to the area for a few minutes can help numb the nerves and reduce swelling, giving you some temporary relief from pain. 4. Gentle cleaning. Be gentle. After a bowel movement, clean the area with soft, unscented toilet paper, a moist towelette, or even a quick rinse. Pat the area dry, don't rub it. This is the most critical part. The best way to deal with hemorrhoids is to stop them from happening in the first place. These strategies are all about reducing that pressure and keeping your bowel movements soft. 1. Get more fiber in your diet. This is non-negotiable. Fiber softens your stool and makes it easier to pass, so you don't have to strain. Aim for 25 to 35 grams of fiber per day. You can get it from fruits, vegetables, and whole grains like oats and lentils. If you have trouble getting enough from food, a fiber supplement like psyllium husk can really help. 2. Stay hydrated. Drinking enough water is just as important as fiber. Water helps the fiber do its job. Aim for at least 8 to 10 glasses of water a day. If you increase your fiber without drinking more water, you can actually make constipation worse. 3. Get moving. Regular exercise helps prevent constipation by keeping your digestive system active. A brisk 30-minute walk most days of the week is a great goal. But if you have painful hemorrhoids, you might want to avoid heavy lifting or exercises like squats that increase abdominal pressure. 4. Rethink your bathroom habits. This is a big one. First, go when you feel the urge. Holding it in can make your stool harder and drier. Second, limit your time on the toilet. Don't make the bathroom your library or social media hub. Sitting for more than a few minutes increases that pressure on your rectal veins. Finally, think about your posture. Using a small stool to elevate your feet changes the angle of your rectum, allowing for an easier bowel movement without all the straining. While home treatments work for most people, there are times when you absolutely should see a doctor. Make an appointment if your symptoms don't get better after a week of home care, or if you have heavy or frequent rectal bleeding. It's so important to get a proper diagnosis to rule out anything more serious. If you have severe pain, you might have a thrombosed hemorrhoid that a doctor can drain, which provides major relief, especially if it's done within the first 72 hours. For persistent and severe hemorrhoids, your doctor might recommend a medical procedure. These can include rubber band ligation, a very common office procedure where a tiny rubber band is placed around the base of an internal hemorrhoid, which cuts off its circulation and makes it fall off. Sclerotherapy. A solution is injected into the hemorrhoid tissue to make it shrink. Surgical hemorrhoidectomy. In the most severe cases, the hemorrhoid is surgically removed. This is the most effective long-term solution, but also has the longest recovery time. If you found this guide helpful, please give this video a thumbs up. It really helps the channel and gets this important information to more people who need to hear it. And for more straightforward health advice you can trust, make sure you subscribe and hit the notification bell so you don't miss our next video. We'd also love to hear from you in the comments. Have you found a particular remedy or lifestyle change that really worked for you? Sharing your experience could help someone else in our community. Remember, hemorrhoids are incredibly common and absolutely nothing to be embarrassed about. By understanding what causes them, that constant pressure from straining, sitting too long, or a diet low in fiber, you have the power to do something about it. Focus on those key prevention strategies. Eat more fiber, drink plenty of water, stay active, and adopt healthier bathroom habits. These changes are the cornerstone of both finding relief and preventing hemorrhoids from coming back. While they can be painful and frustrating, in most cases, they are very manageable. Don't suffer in silence. Take these steps, and if you need to, don't hesitate to talk to a healthcare professional. You deserve to feel good, and relief is available. Thank you for watching.